Hi, my name is Courtney Hilmanowski. I'm a physical therapist and orthopedic clinical specialist at Active PT and Sports, located in Rochester, Minnesota. I'm excited today to be talking to you about swimming-specific considerations for rehabilitation. Some background on me: I was a competitive swimmer for 20 years and swam for the University of Minnesota from 2007 to 2011. I was a long distance freestyle specialist and then also swam the 200 butterfly. I've gone through my own shoulder rehab and injury and can take my own personal experience and then add it into my knowledge on the biomechanics. I ended up with a labral tear my sophomore year in college, redshirted and had that repaired, and then came back for my remaining years of eligibility to swim. Today, what I want to talk about are understanding the general biomechanics of freestyle, the main stroke that is swam, and how that relates to injury. What's the proper form and what are some of the faults that we see with the stroke? And then specific considerations for rehab. So how do we mimic the demands of the sport when we're strengthening? And what does that look like from an open chain, closed chain perspective? What else do we need to look at as far as mobility goes? So with swimming, there are four main strokes. We have freestyle, which is front crawl or one hand over the other, okay? That's swam in practice 81% of the time, no matter what you specialize in as far as the stroke. You have butterfly, which is where both arms come out of the water. Backstroke, done on your back and swam in an alternating arm fashion. Breaststroke is the outlier, where both hands stay below the surface of the water the entire time. Again, freestyle has the largest variety of distances swam. So it starts from the 50 freestyle, which is going to be your sprint, and then it's going to go all the way up to either a 1650 yard or 1500 meter, which is the mile. You have butterfly, backstroke, and breaststroke, which are swam at 100 and 200 distances respectively. And then also the individual medley, which is going to be a combination of all four strokes, which is done at the 200 or the 400 distances. So some quick numbers on why it's so important to understand the mechanics for freestyle. Again, it's trained and practiced 81% of the time, regardless of your stroke specialty. For your elite athletes, so high school and above, they typically take 12 to 14 strokes per 25. If they do 8,000 yards per day, and they do that 6 days a week, you're looking at 13,440 revolutions of the shoulder per week. That's a lot, okay? And so it is super important to understand the mechanics so that we're making sure that we're not putting the shoulder at any sort of disadvantage during those 13,000 revolutions over the course of the week. Now, the typical training load throughout the year is about 40 weeks of training with 1 to 2 weeks of competition. And so it's super critical that we understand how do we work with these athletes and make sure that we're not putting them into too much shoulder work, and how do we strengthen that appropriately to make sure that we're giving them what they need to be able to carry over into their practice and competition season. So all of the resources that we'll be going over today are going to be located on the PDF on the website, okay? So if you guys have specific questions based on the research articles and journal articles that I'm using, you can find those at the end of the presentation and then also on the PDF at the end of that in the work cited there. So a recent study from the NCAA revealed that elite swimmers sustained a shoulder injury at a rate of 4 injuries per 1,000 hours for men and 3.78 injuries per 1,000 hour training for women. And again, shoulder injuries are the most common, with a prevalence between 40 and 91% of injuries reported. And swimming is the only sport where the shoulder initiates the propulsive force compared to the trunk or legs. And so when we're doing rehab, we need to take a multifactorial approach on how do we work with these athletes. So we need to know the stroke biomechanics. We need to understand the overuse and fatigue of the shoulder muscles in the upper back and periscapular region, and also the glenohumeral laxity with the instability that comes along with that. So subacromial impingement is going to be one of the biggest things that we see within the freestyle stroke. And using a 3D videography, 11 healthy swimmers at the University of Iowa were viewed to determine the technical causes of the subacromial impingement. And the mean duration of the shoulder impingement throughout the entire stroke, the freestyle stroke, so from start of hand entry until hand entry again, the mean duration of shoulder impingement was 24% of the stroke. So a quarter of that stroke phase, that shoulder is in impinged position. 14% of that impingement occurred during the catch phase, which is when the the hand is underneath the surface of the water and pulling or catching the water. And 10% occurred during the recovery. And the recovery phase is when the hand and elbow exit the water and circle back through. Okay? The subacromial impingement occurred in the recovery phase at the early exit of the arm. During the catch phase, we also have to take into consider the fluid dynamics. So when our hand is entering the water, the fluid force coming up onto the hand generates a large moment around the shoulder, which elevates the arm forcibly in maximal elevation. And this elevation can create a large compressive force at the subacromial space, which is essentially our nearest testing position. So other kinematic variables that are important to understanding impingement are going to be body roll. So when we're swimming, we're not just swimming flat on the surface of the water. We're actually rotating the trunk and elongating the body to cut through the water, taking away some of the water force or water resistance that we have to cut through. When we are doing the body roll, excessive body roll, so if we're going too far over, our hand is going to cross midline. When that hand crosses midline, we're placing the shoulder into adduction, internal rotation, again, increasing the impingement at that subacromial space. It's also going to be a waste of energy and time. So if we've entered the water and we've crossed midline, we're wasting valuable time getting back to the plane of that shoulder to begin the catch or the pull portion of the stroke. If we don't have enough body roll, so lack of body roll, the stroke, when we enter the water, it's actually going to increase the mechanical stress on the shoulder and lead to improper hand entry. So there's a fine line between too much and not enough. The other thing that we need to take into consideration is breathing. Okay, so with freestyle, your swimmer is either going to have a every stroke breath or an every other stroke breath. And what that would look like is if I'm breathing to the right, and then I would breathe to the right again. A bilateral breathing pattern would look like breathing to the right, head down, stroke, stroke, breathe to the left. What we want to look for is if an athlete has a unilateral breathing pattern, that creates an increased time of shoulder impingement on the ipsilateral side. So if I'm breathing to the right, it's creating a little bit of shoulder impingement every time I go to breathe, okay? It's not a big deal when it's 1 or 2 strokes, but when it's 13,000 revolutions and one side of the body has a little bit more of an impinged position, that adds up. And so that the extra force that has to be exerted to right our body back to the plane of the water is going to increase the demand on that shoulder, okay? That is going to cause the micro traumas, and that can affect anterior stability and lead to impingement at the side that your swimmer is breathing to, if it's a unilateral breathing pattern. What we want to do then is have our swimmers adopt a bilateral breathing pattern, again, meaning every 3 or every 5 strokes, depending upon the distance that they compete. So what we're going to go over in the PDF, there's a great chart on what correct stroke mechanics look like and what we're looking for as far as faults. But I'm going to go over a couple of these so that you understand from a video view what we're looking for. So with freestyle, again, we have the 2 phases of the stroke, which is going to be the catch phase and the recovery phase. In the catch phase, our hand should be entering in front of the shoulder. We've talked about we don't want that hand to cross midline. So our hand is entering in right in front of the shoulder. We also want to enter with the digits 2 through 5 of our hand. That's going to place us into a little bit more external rotation of that shoulder and allow for proper body roll. What we don't want to see is that our hand crosses midline on entry and that we enter in with a thumb down position. Okay, so hand enters right in front of the shoulder, entering in on the second, third, fourth, and fifth digit. As we're pulling through, okay, so I'm on the surface of the water and my hand is entered. This begins the portion of the catch phase where I'm pulling. As I'm pulling through, I want to make sure that my elbow stays high throughout the entire course of that pull as I exit by my hip. Keeping that elbow high is going to generate the most amount of force and pull throughout the full stroke. Okay. We also want to adopt a shallow S curve as we're pulling through. So it's not straight down and it's not this huge S. Just a shallow S curve to create the most amount of contact with our palm throughout the entire pull of the stroke so that we're pulling as much through the water as we can. Problems that we tend to see are going to be a dropped elbow. Okay, so as we've entered the water, the elbow drops below the position of the wrist, and that increases the external rotation of the shoulder and placing the muscles of propulsion at a mechanical disadvantage. So this is an efficiency play. Keeping the elbow high, more efficient stroke. During the recovery, again, that's when the elbow and wrist and the arm exit the water after you've finished by the hip. So we're coming through. We want to make sure that the elbow stays above the wrist, okay? And we also want to make sure that as we are exiting the water, we're at about a 45-degree angle. Not completely on the side at 90, but not flat either. If we're entering in with too much or too little of that body roll, that's going to change how we enter the water as our arm comes through. If, as our arm is coming through, our elbow drops, that's going to lead to the elbow entering the water before the hand and cause an upward force on the humerus, leading to superior translation and impingement. Again, the least amount of time that we can spend in impingement, the better. We're already there 24% of that stroke phase. Let's not get there anymore. Let's master the stroke mechanics and make sure your athlete is spending the least amount of time in that subacromial impingement. The other thing that we need to be considerate of is that swimmers typically are very mobile. In fact, in a study where they looked at swimmers presenting with shoulder pain, 20% of those shoulders presented with pathologic hyperlaxity. With the scapular laxity and the scapular muscle imbalance, the rotator cuff can become insufficient to provide the stability and resulting in translation of that humeral head. Okay. However, some laxity is advantageous to swimmers because it's going to allow them to move into more of a streamlined position, decreasing the water resistance. It's also going to allow the athlete to get into a better body roll, that 45-degree angle body roll, and exert more force during that catch phase. So we want some laxity, but we want to be able to control that laxity. So again, what are we looking at from a stroke mechanic perspective? As a PT, what are my 3 most critical things that I'm looking at when I'm doing a stroke analysis? Bilateral versus unilateral breathing. We want them to be a bilateral breather. Hand entry. Are they entering the water with digit 2 through 5? And are they entering the water in front of the shoulder and not crossing midline? Those are my 3 pearls when I'm looking at swimmers that we can immediately make a difference when looking at stroke technique. So how then do we take the sport that's pretty foreign to a lot of us and then mimic those demands on land in rehab? So swimming is done in a prone position and it has to integrate pelvis, trunk, and shoulder control. So whenever possible, matching the demands on the body and the pull of gravity will improve that carryover into the water. So performing exercises in a modified prone position is going to be our best way to do that. So when you're doing your trunk and shoulder exercises, doing them off of a physio ball or a table, or placing the swimmer in TRX straps or ring variations to integrate that trunk stability, and in that modified prone position, forcing them to work on that trunk and shoulder control at the same time. So the other thing that's super important is that we're strengthening to fatigue, not just sets and reps. So swimmers are typically in the water for 2+ hours at a time, 1 to 2 times a day. And 2-a-days are a pretty normal training volume for your high school athletes and above. And that's usually 4 times a week that they're doing 2-a-days, up to 6 days a week that they're doing 2-a-days. So we need to train the rotator cuff and the periscapular muscles to the point of a 6 to 7 RPE to fatigue. These muscles need to be able to perform throughout the entire practice or race, and our rehab should reflect that. One of the best ways that we can do this is an EMOM. Okay? Every minute on the minute, the swimmer is performing 45 seconds of a shoulder exercise. They get a quick reprieve and you're going again. And you're going for maybe 10, 12, 15 minutes so that we're getting to that point of the 6 to 7 RPE or fatigue. Some other considerations that we need to think about are open chain and closed chain strengthening to work on the stability of the shoulder. Again, 20% of your swimmers are going to be hypermobile. How do we then work on the stability? So we can do that in a closed chain position, and then we can do that in an open chain position. Now, your swimmers are going to come in, and because of the constant pressure of the water or the fluid pressure on the body, they have really poor understanding of proprioception. So you get them on land and they don't have the same surroundings. They have no idea where they're at in space. And so when you're helping them train, giving them a lot of tactile cues and neuromuscular programming early on so that they can figure out what you're talking about with that setting of the shoulder or activating through the shoulder. And then as they start to figure it out, changing the demand, randomizing with verbal and visual cues so that they start to motor program on their own. But when we're doing the closed chain strengthening, again, doing things in more of that plank position or that prone position is going to simulate the sport, as opposed to doing upright or vertical positions like your ball on wall or standing body blade work. Let's get them prone. So one of my favorites is going to be a leopard position shoulder tap, working on setting the shoulders prone, so we're integrating the trunk and the shoulder, and then working on alternating weight bearing. Okay, plank or in a leopard position, give it a try. It's wicked hard, but it's a really great one for your swimmers. Okay, the other thing that we can do is the open chain perturbation style training. So when we're moving through the water, no matter what stroke they swim, the water resistance is constantly hitting them, waves from the other swimmers, waves bouncing off the walls at different directions, so a random direction. And our body has to be able to fine tune so that we're not getting pushed throughout the pull, okay? And so we have to then mimic that with perturbation style training on land. One of my favorites is doing it prone off of a physio ball, either ball or plate drop, and you can change this for the stroke specialization of your athlete. So if I have a freestyler, I'm gonna have them work through the entire phase of the freestyle stroke. If I've got a breaststroker, I'm having them do their ball drops off a physio ball through the breaststroke catch phase, okay? These will all be gone over in a video at the end of this so that you guys can see what I'm talking about and how we individualize that per the athlete's stroke specialty. The other thing that's really critical is thoracic spine mobility. So we've talked about that body roll. That integrates how we can move around the axis from the trunk. So if an athlete has poor thoracic trunk mobility, in both extension and rotation, they're not going to be able to reach that optimal body roll, and it's going to put them in a less hydrodynamic position, okay? So if we have poor thoracic extension mobility, that's going to place our shoulders and our scapula in a protracted position and also decrease the subacromial space, increasing the likelihood for impingement. So we need to be able to put ourselves in a more thoracic neutral position and able to rotate around the axis of the spine. A couple of my favorite things to do with swimmers for this is going to be a lumbar locked position, thoracic rotation. and then also a seated wall slide working into a streamline. Again, these videos will be added at the end of talking through some of these points. So what do we do when we're working with an athlete and they come to you with therapy and you added in some of these exercises? How do we make sure that they're still doing okay in the pool? So the first thing is watching their volume and eliminating pulling with a pull buoy. So a pull buoy is going to be a small styrofoam block, basically, that swimmers put between their legs, and it prevents them from kicking. So it places all the demand on the upper body. So it really works on building that upper body strength. But if they're already having shoulder pain, we want to limit that. Okay, so take them away from what we call pull sets or pulling. The other thing is to discontinue swimming with hand paddles. So hand paddles are going to be these very stiff plastic paddles that attach to the hand. So as you pull, you're pulling with more surface area and you can pull faster and harder, creating a faster stroke. Okay, but again, that's going to place more demand on the shoulder. So we want to take out pulling with paddles and taking out pull sets. The other thing you can look at is decreasing their yardage by about 50 to 70% of their, decreasing their yardage to 50 to 70% of their daily volume. It's going to allow your athlete to continue to train and maintain their aerobic capacity, but limit the total revolutions of the shoulder. Okay. The other thing, if their pain still remains and you've taken out pulling with paddles, then switching them over to kicking only. And we don't want to kick with a kickboard, okay? Because that, again, they're placing their arms on this floating plastic foam piece, okay? And it's just going to raise their shoulders into that pinched position. Instead, what I like to have my swimmers do is kicking in either a prone position with a swimming snorkel, which allows them to be in more of that streamlined position, or kicking on their back, same thing, in a streamlined position. So with the unique demands of the sport, it's imperative that we create a program that integrates the various requirements on the shoulder and addresses the thoracic spine. Adding in specific strengthening for injury risk reduction will promote longevity and help your athletes reach their goals in the water. If you guys have further questions, please feel free to reach out to me. My email will be listed in the PDF. And there's also going to be a couple more exercises that we'll go over on the PDF or other ideas that you can add in for additional information. So please reach out if you have questions. I love talking about swimming, and I'm hopeful that this has helped you with working with athletes that come in that have swim-specific injuries. Thank you. So a couple ways to integrate prone strengthening and shoulder dynamic stability. One of my favorites is going to be a prone mid-row external rotation to press. Looks like this. Hanging off the edge of my physio ball, grabbing my 2.5 or 5 pound plates, coming into a high row external rotation to a press. This would be a great movement for a butterflyer, but if you have a freestyler or backstroker, what you could do is go into one arm hangs out in either a streamline or catch position or in more of a high elbow catch position while the other hand is going through the movement. So high row, external rotation, press, and then my other hand is going to go through the movement, high row, external rotation, press. Another way to work on some open chain perturbation style strengthening is either going to be a ball or a plate drop, working through the different stroke specialties. So if I'm a freestylist, what I could do is, again, with my 2.5 pound plates, one hand is out in a streamlined position, the other hand is dropping the plate throughout the catch phase of my stroke, maintaining that high elbow position. Butterflyers, you can do both arms at the same time. Same with breaststroke, both arms are done at the same time, coming out in front and coming through the catch portion of the stroke, all while maintaining that high elbow position. For closed chain strengthening, I love a shoulder tap in either a high plank or leopard position. Again, done in a prone position, integrating shoulder and trunk control in a weight-bearing position where we're controlling the shoulder and hips while we're moving. So a leopard position shoulder tap, I'm in a quadruped. I'm lifting my knees off 2 inches, my shoulders are set, and without letting my shoulders and hips move, slowly alternating shoulder taps. Okay? If that's too much for your athlete, then just moving into your high plank, shoulders set, nice and slow, controlling the weight-bearing shoulder while you move through the shoulder tap. To work on some thoracic mobility, one of my favorites is going to be a lumbar lock position into thoracic rotation. Starting off in a modified child's pose, butt is on my heels, big toes come to touch, knees go wide. I'm taking my forearm and placing it in midline, and my other hand is going to be behind my back. If that bothers your swimmers, you can have them reach across in the front. What we're working on here is rotating around the axis of the spine and rotating through our collarbone versus just winging the shoulder and cheating the motion. Doing this on both sides. Now the other thing that you can have your swimmers do to work on that thoracic extension is going to be a seated wall slide into a streamline. So sitting with my butt against the wall, I'm creating contact with my low back, my thoracic spine, and the base of my head. From here, I'm going to work into elbows touching and wrists touching, keeping all those points of contact, working into a streamline position. Again, that's going to work on that thoracic extension, but also place your swimmer into a position that they're familiar with. Be mindful that your athletes are going to cheat this to get into that streamline. So if I let my elbows come off just a tad, I can get into that streamline no problem. So making sure that they're keeping contact the entire time. This should feel challenging for your athletes.